These 21 countries have something in common. Less than 1% of their populations are vaccinated against COVID-19. But it's an entirely different story for these countries, where vaccination rates are high and people are lining up for an extra dose. Australia's Health Minister Greg Hunt has said we can expect a booster 12 months after our first vaccinations. But not all experts are convinced we even need a booster just yet. When you get a vaccine, your body builds B cells that produce antibodies capable of binding to the virus. And then there are T cells which patrol the body, seeking and destroying infected cells. Evidence is emerging that those defence systems are deteriorating over time. But that shouldn't be surprising.
We know the majority of vaccines, regardless of whether they're for COVID or any other disease, your antibody level starts waning.
That's where a booster comes in. It's an extra dose of vaccine that props up the protection from the previous doses. We get boosters for tetanus and whooping cough, and new data from Israel is building the case for COVID boosters. Let's say someone was double-dose vaccinated in April. By July, their protection against symptomatic infection was on average down to 79%. But for those vaccinated the previous January, 3 months earlier, protection was just 16%. That's a 63% drop in 4 months. The fall in effectiveness happened in all age groups, and because of that, Israel is offering a booster vaccine to kids as young as 12.
We believe that if enough people will get vaccine, we can get the country back to the routine we knew before the Delta wave began.
But the data doesn't tell the whole story. People who got vaccinated early are more likely to have been more exposed or vulnerable to COVID-19. Healthcare workers, the elderly, the sick. Their vulnerability may not be a sign the vaccines are becoming less effective. It's just that some people are at greater risk of infection than others. The same study also showed vaccines are still very good at keeping people out of hospitals, with 91% effectiveness against severe infection, no matter when you had the vaccination. From the very beginning, that was the main goal.
The goal originally was to protect the healthcare system and to do that by preventing severe illness and death.
That's why some experts are warning against people being given boosters before they're needed. An international group of top scientists, including some from the FDA in the US and the World Health Organization, have said that none of the studies so far provided credible evidence of substantially declining protection against severe disease. So the question might not be whether we need a booster shot, but who needs a booster shot and when.
There are a few groups of people in whom an additional dose of vaccine appears to be very important.
According to the experts, the best candidates for a third dose are those who have weaker immune systems. One study looked at people in the US who've had organ transplants and are fully vaccinated. It found they're 82 times more at risk of a breakthrough infection, getting COVID even after being immunised, and it found they're a staggering 480 times more at risk of becoming seriously ill.
These are people who have immunocompromising conditions that just don't respond to the 2 doses of vaccine sufficiently well to be protected.
Another argument for boosters is that emerging evidence shows mixing and matching vaccines can give a stronger immune response. Researchers in Germany found that mixing a dose of the AstraZeneca vaccine with a Pfizer mRNA vaccine resulted in a better immune response than 2 AstraZeneca doses. It was also as good as or better than 2 Pfizer vaccine doses. That's just for 2, but does that apply to a third?
The messenger RNA vaccine, they can potentially tweak it for variants of concern. I think that will be the future. We'll be getting boosters with something that we didn't get with our first shot.
The more imminent threat is the potential for new variants, and experts say boosters are not the best way to deal with them.
The troubling UK variant.
Countries are detecting that new highly contagious variant.
First identified in India.
The South African, Brazilian, and possibly more deadly.
All the variants of concern, Alpha, Beta, Gamma and Delta, emerged before large numbers of people started getting vaccinated.
That burden of infection in unvaccinated people is what's going to drive the emergence of new variants.
Every time the virus infects someone, it creates copies of itself inside the body. Every once in a while, the copy goes slightly wrong, potentially making it more potent. So the more the virus spreads, the more opportunity it has to evolve into new variants. The big risk here is that a variant will be created that our current vaccines can't control, booster or not. If Delta has taught us anything, it's that the virus doesn't have borders. That's why the World Health Organization has made its stance on booster vaccines very clear.
It's like saying, okay, you have a life jacket and you're adding another one, while others don't have a single life jacket.
That argument implies every person who receives a booster is taking a dose away from someone who hasn't even had one yet. The US government has called it a false choice between distributing boosters and donating vaccines.
We believe we can do both and we don't need to make that choice. So we've taken action on the global level far more than any country around the world.
So far, the US has shipped 114 million vaccine doses to countries in need out of the 500 million doses it pledged. The European Union has donated 8 million doses, only 4% of the 200 million doses it had pledged to send by early August. The Australian government has pledged 20 million to our Pacific neighbours by mid-2022 and has so far delivered just over 3 million.
Pledges do not put vaccines into people's arms. I think we want real vaccines, not just pledged vaccines.
But even if those pledges are met, countries that desperately need vaccines will fall short. 11 billion doses are needed to fully vaccinate 70% of the world against COVID-19. As of September, only about half have been given.
It's bad for them, it's bad for us, because the disease will come back to haunt us from Africa and hurt even the fully vaccinated here with new variants.
What's clear from the outbreaks of the Delta variant around the world is that there's a divide opening up between the haves and have-nots.
We're still in a pandemic of the unvaccinated.
So while the majority of the world remains unvaccinated, experts say the priority for most people should be getting 2 doses into arms, not 3.